Hi, Todd Pratt from the Bodyworks Therapy Center. If you've ever struggled with shoulder pain, you know what it's like to not be able to do the things you enjoy doing. For me, it was not being able to play volleyball. And it was a struggle coming back from that. But if you apply the things you're going to learn in this video, you're going to get rid of those shoulder problems and prevent them from coming back. One of the first things to remember is that the theory of no pain, no gain does not apply in this case. Pain is a good warning sign that tells you to stop the activities and to change the way you do things. Shoulder pain specifically is often an indication that a muscle is strained and there's a lack of blood flow to the area. What we try to get across is that you need to change the position of your shoulder to allow there to be optimal blood flow through the muscles in the rotator cuff. The rotator cuff muscles are actually four muscles put together that combine into a common tendon off the top of the shoulder. When your arm is down tight against your side, like when you're holding it braced against you or when you're sleeping on your side, what you're doing is actually wringing out the blood flow in that area. One of the easiest things you can do, and one of the most beneficial things that you can do, is to listen to your pain. Pain is a warning sign that something is wrong. If you try pushing through that pain, you're going to make things worse. Often people will come in and say, well, it really hurts my shoulder when I go like this, when I lift it sideways, as if they're testing it repeatedly to see if it's still there. Every time you do that, you set up more irritation and you prolong your rehabilitation. You would never punch a bruise, would you? Well, repeatedly testing a painful shoulder to see if it's hurting or trying to push through the pain is just like punching a bruise. You delay your recovery, you prolong your rehabilitation, and now it takes even longer to go back to those things that you enjoy doing. So the concept is, don't punch the bruise. So what's the best treatment for your shoulder? In the case where you have inflammation in the shoulder, ice is the best approach. This complements an anti-inflammatory that the doctor may have already prescribed for you. Ice is a great anti-inflammatory. It reduces the swelling within the very compact, tight shoulder joint and allows the muscles to get back to a more healthy, normal state. So, what position should you rest in if you're having shoulder pain? Well, ideally, if you're sitting, have something between your elbow and your side and prop your arm on a pillow. That'll allow the blood to flow through that rotator cuff with less compression and less impingement in the shoulder. When you sleep, it's probably best to have a pillow between your elbow and your side for the same reason. Prop that arm away from you when you're sleeping. If you're on your back, sometimes it helps to have a pillow under your hand so the shoulder is resting in a more relaxed position. With your hand down on the bed, it often pulls your shoulder forward and compresses the shoulder joint. Alright, what can you do from an exercise standpoint to get your shoulders stronger and feeling better? Well, I'm going to give you 4 of my favorites. Number 1, and probably the most important one you can do, is just elevation on a diagonal. What I mean by that is standing with good posture, meaning we want the shoulders not rounded and elevated, but back and down, but relaxed. There's no need to try and hold that position because you won't be able to maintain it. Back and down, relaxed. From that posture, we're going to work on a diagonal lift. Now, a lot of people see this done in the gym and they'll say, oh, I've done this before, and they go straight sideways. From a side view, there's a big difference between this and that. This tends to put more pinching or compression underneath the shoulder joint. This clears the space better. And this is actually more of a straight forward contraction of your supraspinatus muscle, or the muscle on the top of the rotator cuff. So from the front, a diagonal lift. Now if you do this with weights, what you've got to be able to do is to perform at least 30 repetitions without fatigue before you advance to the next weight. So my patients start with just the weight of their arms. If they're having shoulder pain, this is a struggle for a while. Once they can get to 30 repetitions, no pain, no fatigue, then they move on to the next one. Alright, the next exercise is rotation. The back side of the rotator cuff is responsible for rotating our arm back. The way you exercise that is as if you're reaching back for a seat belt, or you're reaching back to put your hand into a jacket. That's the direction you're going to go in. So as you take that arm, you come down and across to your other hip, you come up and out the other way. Now, in a case where you have shoulder pain, hitting the end of the range back here may be painful. As we said before, we're not trying to make the pain worse here. Don't punch the bruise, don't increase your symptoms. Stop short of where you might have some pain. Same concept applies as far as repetitions go though. If you can do 30 repetitions without weight and no pain or fatigue, then you can go up and use 1 pound. Once you use 1 and do it 30 times, then you can go up to 2, and so on. The next exercise is a bent over exercise where you raise your arm up sideways. You still want to maintain good shoulder posture, correcting that position in shoulder blades, and you're going to bring your arm out straight sideways. Again, no pain. Just to a point where you say that's enough, work until you get fatigued or you do 30 repetitions. If you can do 30 repetitions in this direction, then you can add 1 pound.